Hi, it's Leah here to tell you about Dr. Anthony Pinozzo. He's a pain specialist located in southern Palm Beach County. So if you are somebody that you know is suffering in pain, Dr. Pinozzo is the one you guys need to call. And make that call today because living in pain is no way to go through life. Dr. Pinozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pinozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pinozzo Sports and Medicine Hour.
Good morning, everybody. Hope everyone's doing good. Hey, Linda. We got Linda on the computer. We got Freddie from AMP2.TV broadcasting the show. We got the lovely Marissa, who's our producer, making sure that all your calls come through. I'm Les, and now we got the most important guy in the show, Dr. Pinozzo. How you doing, buddy?
That's me.
Okay, that's a good
I'm
bell.
here.
So we're going to start first by giving everyone the numbers to call. For all of you on BZT and for everyone on ZZR, the number is 1-800-889-0267. And the first thing we're going to do today is a new part of our show. It's going to be called Stump the Doc. If you got a heel pain, you got a back pain, you got a migraine, you got
All I gotta
scoliosis,
tell you is try it.
try to
That's
stump
it,
the doc,
try it.
okay? If you've gone to all the doctors that said, you know what, we can help you, but we can't cure you, Dr. Pinozzo has almost a 99.9% cure rate.
Yes, we do.
And you've got a bunch of people here at the station that will attest to that because they've all seen him. So, Doc.
I'll attest to it myself.
Yeah,
subject
but
to
if
the
you
same
test
thing.
it,
My son does my treatments to me. I have,
Oh, I've been there.
and well, you've seen it. Yeah.
Yes, I have. It's always good when you see your doctor lying on his stomach getting shots for his back.
Yeah.
And then getting up and jumping around going, hey, I feel good.
Well, the best way to evaluate those is to have the problem yourself.
Right.
So
So-
I guarantee everything we say is absolutely true.
And you can always come in to see the doctor, right, Freddie? And he'll take care of you and show you how it's true.
Absolutely,
Yeah.
absolutely. You can't. What is it? You run in.
You
No, limp in, and
leap
leap
out.
out.
That's right.
That was
Leap
Dr.
in, leap
Dr.
in,
Elkins
leap
put
out.
that, gave me that.
Even doctors come to you, so it's got to be something that
Oh,
we're
yeah.
doing right.
Doctors come in.
One of the biggest things
Chiropractors come in.
chiropractors, yes,
Physical therapists come in.
yes. I'm not going to say anything bad
Personal
about
trainers.
I know. Well, you're telling me a story. You had a physical trainer that came all the way from where? Turks and Caicos.
Turks and Caicos. Is that what?
Caicos, that's a country.
Caicos, yeah.
Yeah. To see a personal
Yeah,
trainer.
it's an hour and a half flight.
Well, I think the person that came in from England was even a little further, right?
Yeah. Well, he came in because he's a personal trainer who's having
Right.
problems working.
Uh-huh.
In fact, he had weakness in his arm,
Right.
and which was a shoulder. Actually, it was a shoulder problem.
Okay.
And, so we fixed that. And he came in twice, and he had some really impressive clients.
Really?
Yeah.
Couple of movie stars. You tell me we can't mention their names because their
Movie
names don't want
stars
to.
and real estate moguls. I mean, a lot of people vacation down there.
Mm-hmm.
Anyway, our influence is extending slowly but surely.
Well, when we were having breakfast, you were talking to me about a new patient that came in, a lady who heard us on the radio, and she came in and she said she was almost crying. You were telling me. Tell me about that. What happened?
Oh, she was crooked, bent over. She had this severe pain. She couldn't straighten up.
Oh.
And I had studied this problem years ago and wrote a paper on it.
Mm-hmm.
And it's called a sciatic list, which is when you hurt your back lifting from the side, you're displacing a structure in your back, and which makes you crooked and is very painful. So we learned how to handle that.
Right.
So she left pain-free,
Wow.
straight.
So she was causing the condition.
Well, she hurt herself, and
Right.
they couldn't do anything with it. She couldn't stand. She couldn't lay down. I mean, it was miserable. So
How long, Doc?
She called me on the phone. I said, "Come right in."
How long was she like that?
3 or 4 days.
Wow.
Wow. Would that be an injury that she fell somehow, or just
Lifting, all lifting.
lifting something the wrong way, like what happened with me?
Right.
Yeah, not knowing you have to lift the weights most of my life, not taking a bag and just pulling it out instead of using my feet.
Well, you
pulled
can't
my
stop
groin.
yourself from being injured.
Right.
If that was possible, the NFL would never get hurt.
Yeah, right.
That's true.
But
There wouldn't be any pain.
No, that wouldn't that be great? That I'd even play, Freddie.
No, you
well,
wouldn't.
what would I do for a living if everybody knew they couldn't get hurt?
Well, you know what?
Wait, well, that's, our new
I'd find something though. Don't worry about it.
Oh yeah.
our new board out, she has migraines.
No, Marissa, do you have migraine headaches?
Occasionally, they're not all the time, but I woke up with a really bad one this morning.
Well, you know what Dr. Pinozzo specializes in? Let Marissa know, what do you do for migraines? Talk about, wait.
Well, me?
Oh, yeah, you're the only
you're
guy
the
that I know that
doctor.
can cure a migraine.
The doctor.
Marissa can't, or else she wouldn't have one.
All right, migraine. If it's a true migraine, which is right here,
It's the back of the head.
Back of the head.
where my thumb is and finger, that's where you get it. That's a one-shot deal.
What do you do?
Never comes out. I just told you, it's a one-shot.
One shot gives you a shot.
Gives you a shot.
and
okay.
never comes out. And never comes back.
Ever
I normally get them like above my eye, like here.
above your left eye.
That's a different
Yeah.
type of.
That's
them,
not.
like, above my
That's not a
eyes.
that is
migraine.
not a migraine.
What is that then?
Who knows?
Could be sinus.
Could be TMJ, sinus.
Could it be like a brain tumor or something?
Oh God.
Well, those are pretty rare. Actually.
Yeah. Well, why don't you come and see the doctor now that he knows you?
Yeah, I will.
And he guarantees his results. That's even better. Guarantees his results. Now that Marissa brought up about the migraines, Doc, tell you what happened, because remember, we have a lot of new audiences out there. Right now, you're being broadcast on Pinozzo.tv. People could watch you. Amp2.t, BZT, ZZR, and about 25 to 30 different websites. And we hit our mark, folks. I'll talk to you about that later. Talk to me about migraines. Explain to the people that are new.
Well, we can't disappoint all of them. Migraine doesn't tell you much about where it's from. It's a headache, and a headache is a symptom. Okay, so start out there, and that symptom can come from any place in the neck. But a typical migraine only affects you in the back of the head and up a little bit where my hand is.
That's like
you're
your
on the
left
Pinozzo
side?
TV, you can see it.
Right.
And that's migraine, and that's caused from the COC1, that's a joint.
Okay.
And we learned how to take care of that, and we actually went to the anatomy lab and
That's amazing.
figured it out, and we know it's completely safe. And we do this as one shot, and it comes right out. And you've seen it, because you've been
I've seen it three
Leslie's
times.
been there.
Three times.
It's a commercial on your website
Yep,
with the gentleman that you're treating.
yep, and that's all true, and we do it all the time.
Well, all I know is
Now, the rest of the headaches are from the lower part of the neck, and they'll have an outflow, a symptom in the arm, the trapezius muscle down the arm into the fingers. Those are not typical migraines.
Right.
Now, migraine is only from here to here. That's it.
so you could
Not
cure
in the front either.
you could cure the one if it's the trapeze muscle also, right?
Yeah, anything, well, first of all, you have to know the source of these symptoms.
Right.
And then we have devised a treatment to take care of it. And there's a special film we do also, which is a weight-bearing film. It's a physics. I look at this as a physics problem. And my special film, which carries a patent to it, tells me all the things I need to know, but how to approach these things.
So you can never find that on an MRI.
No, MRIs will never tell you anything.
Is that because it's a one-dimensional thing, or is
Well, it's because it's done laying down, and they don't know where the symptoms are. And so we diagnose you where the symptoms are coming from, and then look at the film, not the other way around. So they're using an MRI as a diagnostic thing, which they should not do. Diagnosis should only be done on a clinical exam by the doctor, never by film. We learned that in the first year of medical school.
really?
Then I got a question.
No, it should never be done, because you can see why.
Yeah. No, believe me, I can see why.
I got a question. A famous pitcher for the Texas Rangers is now going to go through Tommy John surgery. And we talked about Tommy John on this show. But the strange thing is that he went to 4 orthopedics, and they all did MRIs. All of them, all 4, Doc. And they all came out that he needs a Tommy John surgery. So he's out of commission, $24 million off the table, out of commission for a year.
These guys are just totally dishonest. You cannot diagnose anything in the elbow by an MRI. That's the dumbest thing. It's too simple, and it's of a joint. Same thing with the wrist or a shoulder. MRIs are not needed there. If you understand the anatomy, what is it going to tell you? It just gives you a reason to operate. That's all it does. Elbows are too simple. Should never be operated ever.
What about the attachments to the elbow?
It's the same thing.
Same
Everything has an attachment. I mean, you just treat it. That's all. If it's a sprain, look, if you can't straighten it up, it's going to be in the joint. If you can straighten it up, but you drop things, it's going to be muscle. That's how simple this is. This is very, very simple. We do it, I don't understand what these guys are doing with this Tommy John. I just
Well, it's
don't
simple because you're a doctor who studied at Ohio State University and you decided to do musculoskeletal,
Right.
which no one really studies.
None of these
Actually,
guys
in this
study
area,
that.
we're the only ones who do this musculoskeletal treatment.
Yeah.
A lot of people try it, but I don't think they actually do it full time, like I do.
Well, you got some big names in the game. Dr. Johnson, Dr. Parks, Dr. Andrew, all of them. He went to all of them. And they all use MRI. And the only reason I'm bringing this up is because they did the diagnosis through an MRI, which is what a lot of people do. Don't they bring you the MRIs and say, hey,
They
doc,
try. I said, I don't want to see that.
Yes,
here's an MRI. What am I play it as a DVD.
I tell them, look, I'm
It's
a
the
real
music on
doctor.
it.
I diagnose things. We take a history, we do a clinical exam, we do special films, we interpret that, and we know what to do. We don't use an MRI. That's an opinion by somebody else who
That's
never
right.
saw you.
That's right.
there's a difference.
Every
It's a
time you get
difference.
an MRI, it's done by a radiologist who never saw you. The technician lays you down and does the thing. This guy reads it and reports it out. Where is the science in this?
There's really not if you
There
look
is
at it
no
logically,
science.
yeah.
Well, I'll answer that. There is no science in that. It's an opinion, and it's a two-dimensional object they're reading. I mean, you ever see how an MRI is read?
I don't even know what an MRI means.
Well, it's
It's magnetic resonance.
imaging.
Okay. He knows
Imaging,
the letters. What's it
it's-
mean there, big boy?
Absolutely not. I don't know. I know what it stands for.
There's a vibration of molecules in there, and I guess it shows on a film. But they'll read every level. C1, 2, 2, 3, 3, 4, 4, 5, 5, 6. You don't know what you have there. Now, when I do my film, it's a special film, by the way, we already know what to look for. We already know what the diagnosis is, and we get that from the clinical exam and the history. If you don't know where your pain is, you can't get anywhere in my office. You have to know where the pain
the
is.
cause of the pain.
And if you don't know where the pain is, then you're not there for treatment for the pain. You're there for drugs or something, which you don't get.
No drugs, no rehab.
So I'm not really a mean guy, but unless you have a proper history, we're not going to treat you. I just can't do it.
So, Doc, when I go to the restaurant and I see people with their canes and wheelchairs,
You're in the wrong
walking-
restaurant.
No, well, this is Boca, baby.
Okay.
Welcome to Boca.
Boca.
But anyway, and I see these guys, and I go up to them. And I mean, what am I going to do? I said, can I ask you, where's your pain? He tells me my leg, my knee, my ankle. Meanwhile, they can't sit down because their hip hurts, their waist hurts. They're all out of whack.
Yeah.
They can't get up, they can't get down. Are you kidding me? Is that the way you want to live? I mean, this is ridiculous.
Well, they're going to, a lot of them have an HMO, and
Right.
they can't get this stuff treated.
Well, I mean, if you're in pain, I mean, you're not expensive. I mean, you're in
What are
the
you,
realm
$6
of
million? You're the $6 million man? Come on.
no.
I'd like to charge $6 million.
Yeah, so
but
I'm
I
sure
can't.
you would. We wouldn't be sitting here.
I don't.
Well, if you were to logically,
I
to
wouldn't have any
me,
customers. Yeah.
pain. To me, I don't like pain of any kind.
I know that.
You know that I'm like a baby.
Yeah,
And
big baby.
Look, they have to put me asleep when I get my teeth cleaned, and I've had 2 shots.
Let me tell you about the economics that you're dealing with.
Okay.
Any kind of treatment that you get that is prolonged is very expensive. First of all, it's not accurate. That's why it's prolonged. Okay. So, and if you pay for every time you do it 30 days, or 3 weeks or 2 weeks, that's expensive.
Yeah.
But when we treat somebody, we take care of it, most of it, the first day you're there. And we don't look for you to come back.
The only way they come back is if they come back with a different pain.
They have to have a different pain, or they claim I was not successful, which is not true.
No.
It's usually second place. But that's inexpensive because it's only the 1 or 2 times, and that's it. You go to a chiropractor for,
20 years.
20.
I know people that still go to him for 20 years.
I know people have been going for 20 years, Doc. Seriously.
Yeah, they like this adjustment. I mean, that's dangerous,
They make it worse.
Yeah,
They're
it does.
cracking things in place.
But-
So what's the challenge to the doctor? What are we doing with this?
Well, I'm letting people know that here's a challenge. If you could stump Dr. Pinozzo, if you could come in and not be cured of the pain you came in with, I have to preface this. I will take you and your spouse, or you and your girlfriend, or you and your boyfriend out to the Capitol Grill.
So you're taking him to dinner.
Me too.
No, if you could cure the guy, I'm not taking you.
Me too. So wait a minute. So you're
Wait
taking
a
people to
minute.
dinner if they can stump Dr. Pinocchio?
Yes,
In other words, he can't cure them.
yes.
But it has to be a legit pain. It can't be something like.
Well, it's real
tumor.
easy when they come back. He'll put him on his machine and show that they're lying to him because what was causing the pain is not there anymore.
All right. So 800-889-0267. Call up. And
And
we
stop
will
the doc.
start putting these appointments together.
Yeah.
Because we're going to tape it.
Come
Yeah,
on.
we're gonna tape
We're
everything.
going to put it on radio TV.
But I must preface this, of course, it's on radio, and you're making a copy of this, aren't you, Marissa? So I don't get in trouble. Thank you. That it has to be the pain that you came in with. So if you come in with the knee pain and it cures it, then you got a pain in your ankle. That's a different pain.
That's a different thing.
Speaking about ankle, God, how I segued right into that.
Yeah.
We had
He's slick.
We had a.
He's just so slick.
We had the beautiful and talented Leah who came in and wanted to meet Dr. Pinozzo, and she was complaining about an ankle problem, that she was going to a podiatrist and most likely would have to get a boot and therapy. So now, Doc, this to me is the most amazing thing I've seen yet. I've seen a lot of things. She came in and tell what you did. It sounds better when the doctor tells it. Go ahead.
Well, she had filled out the paperwork, and then I watched her walk in from the waiting room. And she said that her ankle was hurting her. I said, well, I don't see that your ankle's hurting you. You're bearing weight nicely. You're not even limping, so it can't be the ankle. So where is the pain? Well, she described where it was. I examined her. I said, well, this is where it's from. And it's only by a lot of experience that you could do it.
Yeah.
You have to know the pain patterns and what's subtle, what's not subtle. There's a lot of them.
That's the key,
are
what you just said, Dr. Pinozzo, the pain pattern.
pain pattern. A lot of them are very subtle. I mean, they just, like we had a runner who had Achilles tendon pain. Now, you cannot hurt an Achilles tendon. I mean, I don't care what
Really?
you do. You're not going to hurt that thing. And if you do, then it's got to be painful by palpation. So by examination, it's got to be painful. Otherwise, it's referred from the lower back. And so you asked me about
Leah.
special cases. The runner, that was from the lower back. It took us 4 treatments to get that out of there. And it did leave. And he's running now all the time. And on Leah's case, it was just one day.
Yeah, one shot, and she was fine.
Yeah, she was fine one day.
And Leah said, there's no way I'm going to wear a
Now,
boot.
see, that's where you save money. If you,
Yeah.
if you have to pay for it yourself, you don't want to go anywhere that is prolonged. 4 or 5, 10, 12, 15 treatments, that costs you money.
3 days is what they say. If a doctor can't cure you in 3 days, go find somebody else.
Yep.
And that's not by me. I will actually give you the doctor's name, and you go look it up.
No, it's true. It's just common sense. If you know what to do, you ought to be able to do it right away, not wait 2 weeks, 3 weeks, 4 weeks. I mean, it's not necessary, really.
So even if you had to go and pay for the treatment, you're looking at 1 in, 1 out, maybe 2, maybe 3 max,
Right.
which is going to cost you out of pocket less.
Oh,
Probably your
sure.
deductible.
Yeah, and we're cognizant of that, too. We like to do it quickly and get somebody taken care of. They can pay the bill because it's not big.
No.
And everybody benefits like that.
Well, to me, the beauty of it is, I came in with pain that started from my groin all the way down to my toe, and he took care of the pain that went from my knee in one shot. I came back the next day. I said, Doc, my groin is killing me. He put his finger. I almost jumped 9,000 feet. Gave me the shot, and guess what? It's been now 3 months.
What about the pain you have when you swing a golf club?
Oh, we're taking care of that next.
Has he come see you for that?
No, he wouldn't let me do that. I don't
yet.
know
Oh, why? He's such a chicken.
I took two. Look, I'm a patient. I know how it works.
Yeah, but I wanted to see because I saw it. I have you on film.
Yes, we do. That was
and me and
yeah.
Doc went over it, and he says, he's a chicken. Because look at the pain. That's
Well,
like, wow, I can see it on
I've
your
been chicken.
face.
I went for 2 shots. Who goes for a shot in the groin? That's got to be worse than a
Yeah,
shot.
well, that was an unbearable pain.
Yeah.
But you do have that swing cut down.
Yeah.
But I'll tell you one thing.
We could improve your swing.
Well, ever since I got the pain in the groin, and you fixed that, I'm able to move better now. I'm able to put the pressure on my right foot, which I
Sure,
couldn't.
you could drive.
But distance is what
Yes.
we have to give you.
When
And
you come
gotta-
back from your vacation, we'll do that.
And we could give you distance.
Okay.
I'm going to tell you, though, you got a good stroke. You got a good swing. But I could see when Doc told me,
It's
look at
pretty
his
strong.
tape. He told me,
Yeah.
he said, look at the tape right there. You
Can't
stop
get all
it.
the way, but yeah, because you
can't.
can't get all. I can't get all. And we tell that to all golfers. Yes, when you come back from vacation, you're gonna give me like 2 shots. Now, if I don't make money from these guys, Doc, we're gonna have to, work on it. Don't fix them because I need to make money as I play golf. Right, Marissa? Okay, Marissa's right there. 'Cause
Well,
she's,
what I always
wanna make
tell,
sure.
what I tell the golfers is, don't tell anybody you've been here.
No,
Take
I
their
tell-
money first,
That's right.
and then tell them.
Well, hold it. I don't want to mention this guy's name because he's an attorney. I don't want to get into trouble. He came as a recommendation after he's been to everybody. Everybody. He came to him, I think, twice, right? You know the guy. I don't want to mention the long hair guy.
With the white hair.
Long hair? You don't remember? Okay. Well, anyhow,
I remember.
See a lot of people every day.
Yeah, I remember.
anyhow, he's like, I can't come back to the doctor anymore. I said, well, what happened? He said, it's costing me too much money now because I'm playing better golf. He fixed my back.
Yeah, but he's stupid. He should.
No, he doesn't have any more pain. I mean, the
Yeah, but
bottom
he
line.
should play it off and
yes.
then bet the big one, and
Hold
there
it.
you go.
That was just a joke.
Oh,
Okay.
I had somebody from the Adios Club
Yeah, that's a big club.
come in, and they're serious golfers there.
Yeah. I mean, these guys play for
they're
some
really
big money.
serious.
Yep.
And he come in. Then he didn't come in, and I asked one of his friends, how's he doing? He said, well, he's in San Francisco in the tournament.
oh man.
So that was on his mind. I had to get him ready for this tournament.
Well, when we come back, we're going to be taking a break. I wanted to get into what's going on with scoliosis because that seems to be hitting the newspapers like crazy, and new facilities are opening up. So, Marissa, we're going to take a short break, and we'll be right back with Dr. Pinozzo.
Hi, it's Leah here to tell you about Dr. Anthony Pinozzo. He's a pain specialist located in Southern Palm Beach County. So if you or somebody that you know is suffering in pain, Dr. Pinozzo is the one you guys need to call. And make that call today because living in pain is no way to go through life. Dr. Pinozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pinozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon.
You're listening to Dr. Pinozzo's Sports and Medicine Hour with Dr. Anthony Pinozzo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pinozzo now at 1-877-927-6969 to get your pain issues resolved. And now, more of Dr. Pinozzo's Sports and Medicine Hour.
You're back.
We are back. Doc, I'm seeing a lot of hospitals now that had never done this before are opening wings for scoliosis for children. And what I've read, I guess most people have read the same thing, is that scoliosis can't be cured. And I've seen it, and it's on your website. Why are they saying that when we know it could be cured? Explain that to me.
They don't inquire how it can be cured.
Okay.
They're going on the surgery. It's a money-making proposition. That's what it is.
Okay.
They build these operating rooms and the rods. This is the worst, absolutely the worst surgery you could ever do to a human being. You might as well cut their head off. I mean, it's just gross.
They can't move it anymore.
They can't move anymore, and they put these things in, and it's not simple surgery. I mean, it's huge, and the incisions are this big. Wow. You don't want to do that. We have the answer to it. It's scar tissue holding those bones crooked, and it's easily fixed if you know how to do it, and I know how to do it. And
Well-
I'm telling you, I put my hand up to God on Bibles. What I'm telling you is true.
Well, we've got it on our website. It shows it.
We reverse the scoliosis right in front of your eyes. And I'm not kidding, because we have a fluoroscope. So we do an image before and after the treatment, and you'll see the turn right there in front of your eyes.
And Les, on
What more do you want? These kids are easy to treat. I mean, they're absolutely easy. There's no reason for having anybody, especially under 20, to have any surgery or rods. It's just criminal. I think it's criminal.
on if you go to
I shouldn't say that,
Penoso.tv,
should
Yeah, you can, sure.
if you go to Penoso.tv, we put some pictures up of people who have scoliosis, and they've had the rods and screws inserted, and they have X-rays. And in some cases, like I have up right now, it did straighten straight, but the metal is in there, which must be really painful.
It's going to be painful right through the years. They will have the misery of life. I mean, I feel sorry for them.
Oh, God,
And I
especially
tell
when it
everybody,
rains.
get these rods out, and I'll be able to take care of this thing. I can't do it while the rods are in there. It's all that inflammation. You can't knock it down. The inflammation is painful, and you can't get rid of it.
Now, one of the pictures I have up, Doc, is that they put in the rods and the screws, but the rods and the screws are still bent. They're still angled slightly to the right.
Right.
So it didn't straighten out completely either.
No, and that's going to be painful to them, and they're going to put stress on the curvature, especially the convex part, and that's going to be painful to them. We treat this all the time.
Tremendous.
I mean, I know what I'm talking about. We treat people with the rods in. My advice to them is to get the rods out. They can't do it. There's no money in it. Nobody will take them out.
And some of these screws, Doc, actually go from left to right through the spine to the other side. I guess it has a bolt holding it in place.
I don't know about that. Usually it's a rod and a spacer.
They have two rods,
Yeah, one on each side.
one on each side.
Yeah.
And then there's a screw that goes from left to right or right to left.
Yeah.
I mean, it looks painful.
Yeah, it is. There's all kinds of techniques. So we don't know which. We could tell if we had a film, but it's like the same thing with the fusion that people go through. Elderly people. I mean, they fuse all these bones, and you say, "What the heck are you doing this for? You don't have to do that." Obviously, they don't know where the pain's from. So the idea is to stabilize the spine. And that's what they're doing with the rods. They're stabilizing the spine so it doesn't get worse. But it doesn't get worse if you know how to treat it. This is a failure of treatment in the worst way. And I condemn it. I don't think it should be done ever. Now, we've had teenagers in the office with scoliosis. With
You're
the,
right. 15-year-old one you've seen in somebody
with the
else.
rotation of the scapula, so their scapula's up like that. And in one day, we reversed all that. And anybody who thinks I'm kidding you, I'm not. I'll give you the names of these people.
Yeah.
You can ask them yourself.
Well, not only did you ask them, we could see it. The people we've seen it. In fact, we have it on Penoso.tv showing the lady from England and the young girl. Am I correct, Freddie, as far as the
That's
young
correct.
girl?
They're both
And it
there.
shows how they came in. And these you can see it anytime. The X-rays don't lie. I mean, I don't know what else to say.
The problem with the fluoroscope is it doesn't store these images very long. So once you get it, you got to use a camera or some software to get it out of
Well,
there.
that's why we have it online. Freddie was able to get download the pictures onto your website.
He's taking a lot of pictures, but it happens all the time.
Right.
I mean, if I don't get the turn, I will go back in there and do something else to make sure I get that turn.
Yeah.
So in other words, you're guaranteed improvement if you come in the office.
I mean, what else is? I mean, come on. I mean,
What else can I tell
and
you? I mean,
you guarantee it.
just because some expert so-called expert at the hospital or somebody has a white coat on and the scrub outfit says, well, you need this and this. Don't believe it. They obviously don't do this kind of work.
No.
They do surgery work. You have to know who you're talking to. You know, we all have that problem. Who are we talking to when we ask for advice?
You got to believe,
You
and that's what they want to
got
do.
to know who you're talking to. You got to know as much as they know.
Yeah.
I mean, if I have somebody who's advising me on something, I say, well, what do you know that I don't know? I want to know as much as you know,
Sure.
so I know if your advice you're giving me. I don't want to do your job, but I want to know that I'm getting the right job done. So stay away from the surgery as much as you can. Don't do it.
we always say to people, make your second opinion your first, and
Yeah,
before before you go under the knife. I mean, to me, and I think everyone who's listening would rather not have to go under the knife. So if you're going under the knife, why not take a half hour maybe, come into Dr. Pinozo's office, and you know what? People sit there and they wait for one reason, because it works. And that's all you have to do is talk to him. If he could guarantee you that he could get rid of the scoliosis, why? I mean, is it me, or is it just people aren't afraid of doing something that the doctors say they shouldn't?
Well, you know, Les, I'm looking at case after case of these turned spines.
Right.
And I'm going to tell you, it's a scary thought.
Yeah, it is.
I'm looking at these young kids, Doc. If I had that in my son, I would be afraid, because it's horrible. I mean, they're twisted bodies. These things are way to the left.
Oh,
You see, the problem is once you get operated, you're stuck with it. When we treat you, you're not stuck with anything. You're going to improve no matter what.
you better.
And if you didn't, so what? You haven't lost anything.
No.
But once you get operated, get the rods in, get this massive surgery done, the blood loss and all. I'm gonna get sick.
No, I know.
talking
It does affect you, because so in other words, when you have those rods and you can't play golf,
Well, here's
you can't do anything, right?
here's an article I was just reading,
Journal of American
and
Medicine.
it's about prevalence and predictors of adolescent idiopathic scoliosis in adolescent ballet dancers. Well, first of all, scoliosis is not idiopathic. That means there's no known cause.
Okay.
And it makes you wonder what these authors are talking about. There's no such thing as idiopathic.
Right.
It's all from trauma. It's a fall.
So in other words, you can't get it because
You can't get
your
it
mother
because
had it
you're
or your
alive.
father had it. You can't get scoliosis.
No, you have to do something. And so these are ballet dancers, and it says that there's 30% of the ballet dancers have this scoliosis. Well, why would that be? Because of the falls that they take as they're learning their craft. Same thing with football players, basketball players. It's all the same thing. Every trauma you get by falling on your buttock is going to manifest itself in a curvature of the spine somehow. And so they're talking about pick up these things before they go to surgery. Well, article like this, they're assuming you need to be operated. They're assuming it's idiopathic. They're assuming this, assuming that. None of it's true, because they don't actually treat this stuff like I do. We treat it. We actually treat it.
And when you do it, it's no rods,
Oh, no.
no physical therapy,
No, nothing.
and no narcotics.
Nothing.
So call up, guys.
No exercise program either.
If you don't want to call up, let me give you Dr. Pinozo's number, and please call after the show. 561.
That doesn't work too well.
I know. 561-381-5800. They usually call you when we're driving on the expressway.
Yeah.
So if you want to call him on his direct line, 561-381-5800. Don't be surprised if Dr. Pinozo actually answers his phone.
No, I had 3 children, and I took care of them. They had all the sports, and none of them had ever had a scoliosis or was crooked. They grew absolutely straight, and I made sure that they did.
Well, I've met 2 of them, so that's true.
Yeah.
I've met 2 of them. So, Doc, so you're saying before anyone even thinks about going in for surgery for this problem, they should see you.
Yeah, because if they're going to a surgeon, they're not going to get this kind of work.
Right.
Okay? Musculoskeletal specialist is what I am. And surgeons do not do this work. They do surgery. So people, know who you're talking to. If you go to four surgeons, what are you going to get? 4 opinions of the same.
That's right.
Because that's the way they're trained.
Right.
Okay? And there's nothing wrong with their training. Sometimes you need that.
Yeah.
But why go to the same kind of guy all the time? You want to go to one surgeon and one non-surgeon, which is me.
Right. I mean, I'll tell you the truth. I would rather go to someone that's going to give me a shot than have to go in for surgery.
Yeah. Well, you don't always need a shot. You
No.
just have to know where the scar tissue is that keeps the scoliosis in place.
I've been there when someone came in and you said you don't have the pain there. I'm not going to give you a shot. You were like, I mean, and we've had someone that called up with a disease that you said, I can't fix that.
Yep.
And why? So let me ask you a question again. I am not saying anything bad about any profession. I'm just reading the facts that I get when I go on the internet and study it. Why are chiropractors treating scoliosis? I mean,
I don't know why, because they don't have results. They can't do it. They don't have the science for
yeah.
it. They don't have the techniques for it. So I don't know why they're wasting their time doing it. Physical therapists the same way.
Well,
You have to know the ins and outs of why it's there, and then have the appropriate treatment. And just getting your back cracked is not going to do it.
well, one of the things that I read, it says that the theory is not based on body knowledge, which is what you've always talked about. They have no. Let me just tell you where to go, folks, if you want to read more. It's EDZARERNST.com. Very well-known physician and practitioner for many, many years. So that also. So here's a problem that for some reason, maybe I'm stupid. Why do people go to these? Again, I'm not saying anything bad about chiropractors. Why do they go there if it can't be cured?
They're sent there by their general doctor.
But if you can't cure the symptom, why do you keep going back?
Well, because it's not well understood what a scoliosis actually is. And I'm trying to tell people that it's a trauma, it's a fall, it's a curvature due to trauma, and it's scarred down that way.
Yeah.
So the ligaments are the problem here.
So how did the scar tissue get there to begin with?
A trauma.
Okay.
I mean, you could do it to your shoulder, your elbow, your
Right.
hand, your wrist. It's all the same structure.
So when someone falls, and when does the scoliosis start showing? I mean, if
Right away.
Oh, it does show right away. Oh,
That's why you're so painful. You stand up and you're crooked.
right.
And nobody appreciates what you have. And especially in a child, you say, "Well, you're a kid. How can you have a pain?"
Well,
That's not true.
one of the things
They do. You have to know how to examine for it.
Doc, you're making my life easy. You're answering questions before I even ask them.
Well, I'm taking a look at the lady from England's video because we pieced together how you worked with her and she was all bent.
Yeah.
And you're showing all of the X-ray, the film, where the scoliosis is actually bent to the left, and it right in front of my eyes, because we put it in rapid motion, it's turning and straightening out, and the top of her neck looked like it got straight. It's the bottom that has some curvature still left at this time. I don't know how you left it, but it's amazing to watch this thing because it's actually, you see right in front of your eyes. It's actually turning.
Yeah,
Yeah.
If you do
That's what we did.
like you did, day after day, you actually see it happening, and you can make a film of it.
That's what we're doing.
Yeah.
We did a
Yeah.
film of it.
Amazing.
And it's
you
an
see it
amazing
happening
thing.
right in front of your eyes. I keep telling people, you're going to see it right in front of your eyes. Get
So
it done.
if
she's laying down on the table.
No, I mean, I saw it from a year ago when I first saw her.
But she's laying on the table, and he has his hand where there was a lump, and then we have his hand, and the lump is practically gone. And it's the same table, it's the same woman. It's unbelievable. Unbelievable.
Yeah. Now, the younger you are, the faster it turns.
Oh, because you heal better, right?
See, the faster it goes. So don't go and get a surgery when you're under 50 or under 80. Don't do it.
At least go in and
easily
meet with
treated.
you and talk to you.
This is new. This is new research work, by the way. It's unpublished, but when editors see an article that refutes everything they know, what do you think they're going to do?
They're not going to.
They're going to say you're crazy. We're not going to
course.
publish this. This is what they do.
Because they've been.
We had this is a true story. We had a back to work workman's comp injuries, and it was 100 consecutive cases. We did it 5 years apart, two studies the same. We had a 92.5% back to work
Wow.
to the same job
Wow.
and no time off.
Saving
All
money
So
to
I
the
tried
country.
I tried to publish this. This is absolutely true. And they said, well, we don't believe it because the national average is only 35% back to work. I said, "What you're supposed to publish something like this?"
Sure.
Because it's different than what you have. But this is the thinking there. I can't get over it.
Well,
the
today
reason
is.
I've mentioned it is because even to this day, I remember that, and that happened about 10 years ago, 15 years ago.
Well, we got a lot of people going to all those websites we have, and we have a question about scoliosis from Samantha, who saw you on Twitter. Did I say it right? Twitter.
Tweeter.
How many visits does the procedure?
Twitter's the thing.
Twitter's when you go like that, right?
Tweeter's a bird from the cartoons.
If you type something,
I
you
got
are a tweeter.
You're a tweeter, okay. So this is a Twitter, right? Okay.
Tweet.
It says, how many visits
Tweet.
does the procedure for scoliosis take? There is a new commercial about a big hospital that now is offering services for this procedure, and the commercial had rods and screws into the spine on x-rays. How can they do this repair this way and you do what you do without all this metal?
Well, just think about this a little bit.
Okay.
Okay, you have a curvature, and they put the screws in and rods. So what happens to the curvature? Does it improve?
No.
It stays exactly that way.
I
that's
have pictures.
right.
I see it.
That is right,
That's what
yeah.
I'm looking at.
And we're saying you should straighten those up. You can rotate the bone structure. You can get rid of the concavity by derotating the bone structure. So you have to know about this, where the scar tissue is. And so it's a failure. It's a massive failure of treatment to put any surgery on a scoliotic. It's a massive failure of treatment. They just don't understand it. That's why they operate.
Whoa. I got a question.
Uh-huh.
You're under the knife, and you got all this tissue that's pushing the pressure, right? Mm-hmm. When he straightens out the spine to put these rods in, what's he do with the tissue? Does he cut the tissue out? Make a cheeseburger? What's he do with it?
No, it just stretches out. I mean, this massive
So it's still there.
disruption. That's why there's so much pain afterwards. It's a massive
That must have
disruption
hurt.
Pain is-
of all the connective tissue. Those should have to be taken care of, each individual one by themselves in our method, and then you get straight, no problem after that.
Man. Amazing.
That's painful.
I mean, folks.
What I did there was, that research I did was only because I see so much of it, and I could put it together. And when I start getting results, that's when we start talking about this. But you got to give me a chance to help you if I can, and I will. I mean, there's no problem with it.
Well, we know it works. I mean, so if you want to call Dr. Pinozo after we leave the show or tomorrow, it's 561-381-5800. But if you have a question that you want the lovely Marissa to give that question to me, it's 800-889-0267. Okay, now let's see what we got here. We got a bunch of questions here, Doc. Santora, very sexy name. Santori's. Are you related to this lady?
Not at all.
No, okay, you're Santori.
Yeah.
Okay. From Facebook comments, I hate walking in what's a bench stroller?
You ever see when they sit or they can hold on to the stroller?
Okay. She said when she goes to the restroom, but my hip is bothering me to the end. The doctor says I need a hip replacement. Oh, we talked about this a lot. And I told them what you said. No, that's how she's raised it. They informed me that removing inflammation from my hip area will not stop the pain, and I will continue to be in that chair.
That whoever told her that's a liar.
Okay.
They know better. All pain is inflammation in origin, all of it. And there is no pain fibers in the hip joint itself. Did you know that?
No,
I did not know that.
I know it now.
And not in the knee either, not in the ankle. Otherwise, every time you took a step, you'd feel it.
Right.
I mean, think back to the
That's
design.
True. That's true.
And function, how we actually move around. When I stand on my one leg, I'm compressing. I put 100. What do I weigh?
140?
170 pounds.
170 pounds?
On one hip joint, and I don't feel it. Why is that? Because there's no pain fibers inside the joint, and the ligament structure around it is not inflamed. That's why it doesn't hurt.
So what's the pain? The muscle?
Pain is ligament, which is a bone-to-bone connector.
Mm-hmm. So,
And no one talks about ligaments. They're
No.
always talking about muscles. I mean, that's ridiculous.
They confuse the issue, Doc.
They actually confuse the issue for personal gain, I
I
think.
hear you.
and they're
I
also
hear you.
trained differently.
And
They don't study the musculoskeletal and the physics
well,
of
the
the
physical
body.
therapist says, well, you have a muscle imbalance, so we'll strengthen you. I mean, that's ridiculous. It's not muscle at all.
Is that a 2-year course they take?
4.
Oh, it's 4 years before.
4 years.
So that's
Well,
2
you can stretch it out, you can stretch it out to 10. That doesn't mean anything.
That's what I want to go to. 10-year doc.
Unbelievable. Cody from Twitter
Twitter.
writes, I have a very stiff neck for 3 days. I get this a lot, but doctors say warm compresses will help clear it up. I feel worse than when I went to see them. Can you explain what's going on, and can you help me?
That's an interesting question.
Wow.
Stiff neck.
Yeah, a stiff neck is caused by ligament structure between the bones, and you have to be able to diagnose that. And using ice or heat does not going to help you. The best thing is take 3 aspirin and forget about it.
Really?
It goes away. Why? Because it's ligament again. And we know how to diagnose those things. We do a special x-ray, we do clinical exam, special history, and so we know where that pain is coming from. And then we use a film to find out how we're going to approach it. And there's your science there.
Right.
So we explain it to people, show it to them, what we're going to do, and we do it. And they get the result.
Now here's somebody, I wonder if she waited on us, from Twitter again, right? Sophia! She says she works 15 hours per day as a waitress in Boynton Beach. I don't know, we eat there, don't we? Those times? Okay. She says being on her feet all day, they get swollen. Can you help them with tired legs?
Well, there is a referred pain from the lower back, which goes into the legs in specific areas, and we could treat that. So she might be referring to that.
Okay, so that's what we call.
But you can't tell from that.
No.
What actually.
We appreciate everyone writing in, but Dr. Pinozo could only answer certain questions because he has to actually see where the pain comes from.
It's a method of taking the subject, which I have. So it's a referred pain, and it's diagnosable and treatable.
What I find interesting is that doctors that are treating people, they give them statements like that. Water on the knee.
Yeah.
Or tired legs, or they just make it sound complicated to sort of make you afraid. What are you gonna do? Tell a doc, no, I don't.
No, but yeah, that's exactly right. Yeah.
I mean,
water on
Melissa's-
the knee. People take water on the knee off. You should never touch it because it's there for a reason. So you should treat the cause
You hear that,
of
Marissa?
the knee problem, not take the water off the knee. It'll self-absorb. There's no
Well,
problem
Melissa's
with that.
dad is having surgery in 2 weeks. Melissa,
Well-
tell us what your dad is having done.
The doctor he doesn't want to have surgery. He's trying to get a second opinion, but the doctor told him he has water on his knee, and he has like this bubble, I guess, or something. What would that be then if
sac.
it's not water?
It's a bubble sac, water
It's
sac.
What?
It has a water sac. It's
Water.
the inflammation is caused some kind of pus and blood in there.
Really?
Is it pus and blood?
Yeah, that's what happens to football players too. I seen them drain that thing out.
Yeah, but I wouldn't drain it. I'd leave
I
it in.
understand that. Melissa, you see that? Make your second opinion your first, or your last. That's what he needs to do,
Okay.
and it's
We
curable.
have people coming from far north. Where is Vero Beach?
North.
No,
Yeah, it's like 2 hours, right?
Yeah.
Well, they come down to see me about their knees.
You got the guy from Stewart that came down.
Stuart,
Listen, I come down from Alaska if I don't have to go under the knife. Are you kidding me? But her father's scheduled to have, what is it they said about his meniscus?
They said he has a tear in it, or it's torn or something.
first of all, you
you
can't
gonna do
tear
that?
a meniscus. A meniscus is the cartilage between the bones, and it's flat. How in the hell would you tear it? You can't tear it. It's flat. You can only tear something that's sticking up. This is flat. So what happens is you get a sprain of the ligament that surrounds the bone, the knee. And nobody ever talks about that, but it is an actual structure which holds the bones in place and allows some motion and is easily injured. But
Can you tear that? around
no,
the knee?
there's just sprains. You can't tear anything.
You can't.
No, every time they report a tear, you got to say, what the hell are they drinking? You can't tear anything.
It's just fear.
I mean,
Melissa, your doc ever tell your father ever tell the doctor? No, I don't.
No, he probably just listened to the doctor.
That's what happens.
Yeah.
They've been
That-
giving him cortisone shots too, and that hasn't
No,
been helping.
that's the
you
worst.
should never inject the knee inside the knee, ever. for any reason. There's no reason to go in
He's
there.
had 3 of them, and he's in more pain now than he was before.
There you have
Well,
it. Bring that
that's
belt.
the reason.
Bring that belt. There you have it.
That's
what they-
it.
That's
That's
because
exactly
they
what
missed-
happens.
They missed a ligament. That's why.
And
Marissa-
Melissa, it's just gonna get worse.
Okay.
You're, now that you work with us, hopefully you're going to be here with us a while. Tell your dad it's just worth just going in there. Where do you live? This Boca area, Delray?
We live in Royal Palm Beach, which is like 20 minutes from here.
It's worth it.
Okay.
I mean, just before he goes in for the surgery, let him see, and
He's been postponing it. He doesn't want to do it.
well,
Do you know how large that area is in actuality? I made a study of this. The knee is about 16 or 18 inches around. The problem area is only about that long, about 2 inches. So they're taking a perfectly good knee and throwing it away.
and then all the rehab afterwards, and the
Yeah.
drugs.
And there's big money in
He's
it.
been going to physical therapy, and that's
oh
the
God,
reason
no,
hasn't
don't
been
go to
helping.
physical therapy. It makes it worse.
Wait, hold it. He's going for physical therapy, and what did you say?
And it still hasn't helped.
Gee, I
It's
wonder
not gonna
why.
help him. It's not
Marissa?
meant to.
Are you close to your dad?
What?
Are you real close to your father?
I can't.
Are you close to your dad?
Yes. Yes.
Send him to Dr. Pinozzo. He'll love you forever.
Okay.
Because we know somebody that
I'll
worked.
definitely be his favorite then.
We definitely know because we had someone
Wait
that
a
worked at
minute.
the station.
He's going to love me forever.
Of course, he's gonna love you
Yes.
forever. You're gonna be his other son.
Then he could go play golf again.
Oh,
yes.
God, yes. When you're a golfer, when you play the game, I shouldn't say when I'm a
Yeah,
golfer.
when you play.
That's a
game.
euphemism. You
That's
should.
it.
The drive, talking about golfers, the drive is really a medical problem, and
Yeah.
the PGA guys don't understand it. They don't recognize it, and they don't appreciate it at all. But how do you get that club head to do that is very, very difficult. Every part of your body, from the head down, has to work in sequence to
Right.
get that over there.
Yeah.
If you have a pain like Tiger Woods, you're not going to swing that club. There's no way you can do it.
And
Yeah.
Melissa, you know who Tiger Woods is?
Yeah, she knows who he is.
Well, just in case you don't know. Well, he had surgery.
A lot of
and,
surgery.
And he had a lot of surgery, and now he's not the same.
No.
And now the guys who performed the surgery, they're blaming the rehab people.
Yes, that's true.
And the rehab people are blaming
The
the,
doctor.
MRI people.
Yeah.
And the MRI people are blaming that. I mean, it's going all around.
They're all at fault because nobody understands their job, what they're
Millions
supposed to
and
be doing.
millions of dollars,
You want
folks.
to bring that swing to normal, not change it.
That's right.
So you don't want to operate it. You don't want to rehab it. Forget about all that. You want the swing analyzed for structure. What's causing it to be erratic? You fix that, goes back to normal, and you hit that ball again. That's what should be done. Now, that's a true physician talking. See, the rest are just, I don't know what they're doing. But you don't operate on someone who needs mobility.
And he
You don't
needs mobility.
You don't have mobility after you get operated, no matter what. A
Tell that
scar
to your
is
dad.
Immobile.
You could have him call you. Set up an appointment. You look like you're very sick in there today. You have a cold?
I've had a cold for like a month. It's not going away.
You have a
That's
shot
the
for
pain
that?
in your head.
Yeah.
The pain in their head.
No, I don't have any treatment for that.
No, because you can't cure a cold. That no one realize. What I would do if you do, just tell him to come in and talk to the doctor. I mean, I've seen it. Freddie's. We've both had
We're
it.
patients.
We're patients. Jimmy is a patient. I don't know if you know Jimmy up
Yep.
at the Treasure Coast. Ask Jimmy. We ask another question. We still got time for another couple questions. Are you okay? Sally
Talking
from,
to the mic.
Oh, Sally from Pinterest posted, I'm a 15-year-old gymnast and was told that my torn rotator cuff would require surgery. I'm agreed that first part of it.
You know, I don't know. These surgeons have no conscience. To operate a 15-year-old has got to be, I think it's, well, should I say it?
Yes.
I think it's criminal. Don't
Yeah,
do
well,
it.
it is if you're operating on someone that can't fix it.
You can't do damage unless you fall down from the Empire State Building onto the pavement. That's the only way you could tear anything. You can have a sprain, but not a tear.
Okay.
And sprains are treatable if you know how to do it. And we know how to do it.
And surgery, they're putting her under the knife to fix a sprain?
Yeah.
Wow.
That's essentially it. Yeah.
Wow.
It's funny because Sally is
The
pushing.
rotator cuff is just a sprain. It's a ligament.
her parents are pushing her to go for surgery, and this is very cute.
No,
and here's what she
parents
says. I asked them to please watch your show today and learn that there is another way, and they will be watching today. So can you please explain why a torn rotator cuff can be repaired?
Wow.
Because it's not a rotator cuff usually. Rotator cuff, when I diagnose that, it's only out to the side here. That's all. It lifts your arm. That's your rotator cuff.
Right.
And it's a one shot there and clears it right up.
So,
There's
Sally,
no need for anything else. You don't have to do anything. No treatments, no therapy, no surgery, nothing.
You know, Doc,
It's too simple.
You got that's right. You know what I'm going to say. Here you have a kid
It's not-
educating her parents.
But it's not simple. I had to go and reevaluate the whole thing that I was taught.
Yeah, but make it sound a little more complicated.
Oh,
no, but here's the bottom line.
I
Here's
know
a
that. I'm
kid
being
that's actually telling her
facetious. Yes,
parents.
that's right.
She's afraid to go in for surgery.
She's trying to educate her parents.
Which is
a good idea.
parents should never push anybody to surgery.
That's why I like
Honest
these
to God,
15-year-olds and
it's terrible.
6-year-olds that are going on the websites and learning these things, which I think that's a great thing. But she's pushing her parents.
Absolutely.
Okay, we're coming to the end. I see Marissa just put up the sign. I have 4 minutes. Marissa, do I have time for one more question? Okay.
Your dad not called yet?
Okay. Okay, here we go. Robert from Google. This one I can understand. He writes,
Talking to the mic.
does having flat feet make your ankles swollen and in pain? If so, can you help someone like me with flat feet?
Flat feet can be helped.
Okay.
We did a lot of research on that, and we know what makes a flat foot, and we can fix it up relatively easily. I mean, you'd be surprised. Well, everything's easy if you know how to do it.
Well, I mean, for 45, 50 years, you've been studying musculoskeletal and physics of the body, which I don't think any doctor does that.
Yeah, remember, I had to do all this. We do these treatments in the office.
Mm-hmm.
We don't farm it out.
No
hospitals are involved. No surgeries involved. So we have to learn how to take care of this. Hey, I have to make a living, and we do it right.
So I'm going to say we're coming down to the close right now. It's 561-381-5800 is where you call Dr. Pinozzo to make an appointment. I'm not going to give you the other number because it's too late. We can't take your call now. So it's 561-381-5800. Is there anybody else that wants to say anything as far as people that they know who have had these problems that we've told them to see Dr. Pinozzo? I know you have. I tell everybody.
No, I tell everybody now. I go to dinner and I see people in walkers and stuff and say, come here.
I was just telling Dr. Pinozzo, a girl from the gym was in a car accident, and
the phone began.
There we go. I knew it. I kid you, people wait.
2 minutes, please. 2 minutes.
And I told her to call Dr. Pinozzo. They wanted to go for therapy. I said, don't. I said, you go to see Dr. Pinozzo. He doesn't fix this for you. You know what I'm going to do? I'm going to take you out to lunch.
There you go.
So everybody, we want to say goodbye. Have a great Sunday.
Bye. Thanks very much.
And thank you for listening. And call Dr. Pinozzo at 561-381-5800. Thank you, Linda. Thank you, Freddie. And thank you, Marissa. Have a great Sunday, everybody.
See you.
This has been the Dr. Pinozzo Sports and Medicine Hour with Dr. Anthony Pinozzo. If you spend 5 minutes with Dr. Pinozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pinozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pinozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pinozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.